Hello, my name is Dr. Melanie Bourgeot. I'm a third-year pathology resident at Emory University, and welcome to my 7th and final video in my series on adnexal tumors. Our final topic is papillary tumors. Before I get started, I just want to thank everyone who's watched these videos and subscribed to my channel. I really do appreciate it. Now, before I start getting too sentimental, let's get into our final unknown case, which, as usual, you can view yourself using the link in the video description. This is an exophytic lesion on the scalp of a 23-year-old female. So with low power, you can see that this lesion is definitely exophytic and papillary. However, there is also an endophytic component that also has a papillary architecture, as evidenced by these floating islands of epithelium with a fibrovascular core. The exophytic component is lined by keratinizing stratified squamous epithelium, so essentially normal epidermis. If I can put on my reactive derm path hat for a moment, I'll point out that the surface does have reactive changes, such as erosion, acanthosis, parakeratosis, and spongiosis, but it's otherwise unremarkable. However, the endophytic component is where things get interesting. As you can see here, these papillae are lined by a double layer of epithelium with some gland formation present as well. The last thing to notice is that these fibrovascular cores are absolutely loaded, just full of plasma cells. So this is an example of syringocystadenoma papilliferum, or SCAP, which is what I'll be calling it for the rest of this video. SCAP is a benign sweat gland tumor that commonly arises on the scalp. It is also the most common adnexal tumor to arise from nevus sebaceous, which, as you recall from my first video, is a hamartomatous lesion that commonly arises on the scalp in infants and becomes papillomatous and greasy at puberty. Key features of SCAP include an exophytic and endophytic component, papillae lined by a double layer of sweat gland epithelium, and fibrovascular cores with abundant plasma cells. Hydroadenoma papilliferum and digital papillary adenocarcinoma are two other papillary sweat gland tumors. However, they don't really enter the differential with each other because, like real estate, it's all about location with these guys. Hydroadenoma papilliferum characteristically presents as a skin-colored nodule in the anogenital region of women. Histologically, it is a well-circumscribed dermal nodule composed of narrow anastomosing papillae in a maze-like arrangement, lined by a double layer of sweat gland epithelium. Digital papillary adenocarcinoma is a rare lesion, but often presents as one or more slow-growing nodules on the distal extremities, particularly the fingers, of middle-aged males. Microscopically, it consists of multiple deep dermal or subcutaneous nodules, usually with areas of infiltrative growth and surrounding fibrosis. Most lesions have cystic areas containing papillary and micropapillary structures lined by a double layer of sweat gland epithelium, as well as solid areas of cells with tubule formation. Atypia and mitotic activity can be widely variable, although most cases show mild to moderate nuclear atypia. However, these histologic features, such as atypia, mitotic activity, necrosis, and % solid area, are not helpful in predicting prognosis, as even deceptively bland cases can recur and metastasize. Speaking of prognosis, local recurrence in these lesions is common, and can occur in up to half of cases, especially if not treated with wide resection or amputation. Metastasis occurs in approximately 20% of cases, and mainly go to the lung and lymph nodes. They can even occur many years after initial presentation, including up to 20 years later in one case. If you'd like to learn more, I've included a link to 2 studies of digital papillary adenocarcinoma in the video description. Lastly, because of the clinical consequences of misdiagnosing this lesion, any papillary tumor in the digits should be regarded as digital papillary adenocarcinoma until proven otherwise. And with that, we've reached the end of this video and of this series. Once again, I just want to say how grateful I am to everyone who watched these videos and subscribed to my channel. I really do appreciate it. I also want to thank Dr. Jared Gardner for being such a great mentor during this project. Thanks for watching, and stay tuned for more videos in the future.